Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is George Pappas, CEO at Intraprise Health. George, welcome to the show.
Thank you, Matt. It's great to be here.
So, George, what I always like to do before getting into the main part of the conversation is give my guests a chance to provide more of an introduction in terms of who they are and what they do. So, George, the floor is yours.
Thank you. Matt, Intraprise Health is a provider of risk management, automation, and services for the healthcare industry. And, we really help people deal with a lot of the challenges they have today around complexity and scale. A typical hospital or large medical practice client of ours is sort of not fully able within the confines of cost and time to do really the kind of assessing they need to really protect themselves, especially in this increasing climate of very aggressive cybersecurity activity. So, that's our main business. We also got our start early on back in 2011 as high trust assessors. So, we were the first healthcare high trust assessor, and understanding the elegance and kind of the power, the precision of that method. It's also a very intensive method. So we've really been working on ways to make more of the value of that more accessible to other participants in the healthcare ecosystem.
Yeah, no, kind of security and protection are certainly very important topics within this industry. And kind of before we get into that, the other thing I'm always curious about is what got you into healthcare in the first place?
I've been a career software industry person and involved in many different high technology ventures. And I joined a company back in 2015 named Dr. First. I was there for 7 years. And, we were in the medication management business. And I got to see sort of from the inside the real dynamics of how healthcare technology impacts patient care and patient delivery, because prescriptions affect every patient. And so, it was a really wake-up call for me. And part of that, I was a patient, never been involved in the inside, to really understand the complexity and all the economic dynamics that go along with how does a patient get care? How do they get their therapy? How do they get better? And really out of that, I've developed a real appreciation and care for how can we make our system work better, because it's such a complex service, with a lot of very complicated sets of technologies and regulations and financial constraints, that it's kind of a minefield that clients have to navigate.
And kind of coming at it from that perspective of how can you make the system work better, how do you view security as fitting into that process?
Oh, man. I mean, if you look at where we are today here in, September of 24, it's sort of a perfect storm environment, because the technology, plant and equipment, and the complexity of the regulatory environment and the complexity of the service healthcare being delivered itself have reached this point where there's a lot of vulnerability. And, the primary reason for that, Matt, is that if you look across all of the 5,000-ish hospitals in the United States, the 1 million physicians practicing through hospitals and clinics and ambulatory and post-acute settings, they're working by and large in some still very old and brittle enterprise software systems, because they're very complex and hard to change. And many, many healthcare delivery organizations are running at a break even or slightly losing money every year because of the way our reimbursement system works and the patient census that they have for their organization. So their ability to invest more aggressively in cybersecurity, risk management, and prevention, there's a lot of pressure there, because if you're a rural hospital and you're negative 10% margin every year, you've got to find a way to get more ER docs, more nursing support. Your cybersecurity budget's going to be under a lot of pressure, even though you've got a 15-year-old EHR and several thousand laptops and all kinds of potential, entry points for cyber attacks.
Yeah, so kind of unfortunately, that sounds like it paints a relatively bleak picture, which also arguably is backed up by the number of incidents that are reported on. So always liking to try to be on the optimistic side of things. How, kind of what actions or activities do you see that can begin to help maybe break those burdens down into more manageable pieces and help reduce that feeling of being overwhelmed by everything that needs to occur?
Oh, very good question. Our federal government, our agencies have been waking up to this problem now for the last couple of years. There's been a lot of really good work done by the Healthcare Sector Coordinating Council, by the 405D Project, even by CISA. So all the agencies that have to either provide support financially, operationally, provide guidance with some form of regulations that are common sense regulations. There's been a lot of work now for the last couple of years that's hitting at the right time. I would even say I get my acronyms mixed up, Healthcare Sector Coordinating Council. They started their work, and HHS worked with several people from private industry, hospital operators, and they did a really good job of taking kind of what are the best practices of cybersecurity and boiling them down and then sizing them for a 10-doctor office, 25-bed critical access hospital, 100-bed, small area hospital, community hospital, 300 beds. And they did a very good job of really saying, hey, look, they produced a body of work that said, here's the way people are trying to protect themselves today. Here's kind of a benchmark of where you should try to be in terms of your investment level. And here's where you should try and be in terms of resource level. And that set the stage now for, like, New York is really the first state to arrive at a regulatory decision this year, building on their own cyber law for all industries for healthcare that had some grant money. The Biden White House has a proposal in this year's budget for about $1.5 billion, split between two pieces, one for truly at-need hospital systems and one for enhanced goals, and taking that original work I just described, coming up with two tiers of, they call them CPGs or cybersecurity performance goals. So they're saying, hey, look, we're going to give you 1.5 years or 2 years. There's going to be some money. We're going to start to hold you to a standard. And here's what you need to do to get there. So I think there's been a pretty good recognition that, risk management in general has been always left sort of as an afterthought. Regulatory compliance with the least amount of investment possible has been kind of the order of the day. But then, what a lot of systems have done, which is natural, is they've said, well, I don't have my risk management done, but I'll get endpoint detection, I'll get data loss prevention, I'll get two-factor authentication. So they're sort of covering the obvious, but the idea behind risk management is it's the non-obvious that can kill you, right? And so that's where, the pressure and the support and the clarity of what's next. I think there's been a lot of progress made that now we're going to have to get after it and start doing it.
And that's a great point that you just raised, which is that, a lot of different obvious tools were thrown at what was the perceived issue. So does that suggest that, kind of as the awareness in, whether it be government or agency or joint public-private efforts continue to focus on this, that now we're actually getting better education and better discussion around what the, not lower level, but the more in-depth issues are. So that way you can have, as you just described, a more comprehensive risk management program as opposed to just endpoint solutions.
Yes. And the other dynamic here that's important to mention is cyber insurance, because that's sort of like a Wild West still. And it's very volatile right now because the payers the insurance companies in this space, they don't really know how to calibrate risk yet, because the dynamics of how people get attacked, what their ultimate liability is kind of unfolding before our eyes right now. And there's actually another recent effort it was actually by the White House, and then it was a bipartisan bill in the House, I think just this week, about cyber insurance for systemic healthcare risk. And then Senator Warner, even starting a few years ago, had a position paper on kind of healthcare, cybersecurity as patient safety. And he talked about normalizing the cyber insurance market with some reinsurance and some best practices that if a hospital entity or a medical entity followed them, they would have a form of safe harbor from certain liabilities. Because, the ultimate recognition here, Matt, it's sort of like, in the software industry, you're not going to tell somebody, I can provide you a bug-free product. If you had that, it would be, $50 million for one deliverable. If this task was safe enough, important enough. You can't say if you do all these things, you will not be attacked. We can say, and there's a lot of evidence that if you take these steps, the probability of being attacked goes down. But essentially, I think what Senator Warner was trying to say a couple of years ago was we've got to find a way to give the insurance industry and the healthcare entities a clear picture of what they should be doing, recognizing that we have nation state actors, we have sort of quietly sponsored nation state actors. Everybody is trying to get at this information because they know it's among the most valuable data you can steal, and that the ransomware demands and the moral hazard of how they get paid is kind of easy pickings for a lot of them. So, I think we need some predictability and stability in the cyber insurance market that will drive to recognition of these CPGs, NIST 2.0 that just came out. Because, there's a lot of these different frameworks, but they're really different views of essentially a very similar information. And so helping a client understand how to do that, knowing that they can, whatever the prism of the regulatory need is, or the prism of the cyber insurance carrier, pre-existing examination is, they can kind of, basically cope with that.
Yeah, no, and kind of as you said, that it's so many different interconnected and interwoven components that it's, helping one area is always going to have an unintentional benefit of helping in another area. And, your discussion around cyber insurance is so well timed as well, because, I suspect a lot of organizations out there are finding it difficult to either find reasonable coverage and or affordable coverage because, I think, as you said, the insurers are figuring this out in real time as constant exposures are occurring. And, no insurer wants to keep paying out on a policy.
No, it's understandable, right? So sort of like if you didn't understand the hurricane season and you got nailed, what would you do? Well, you'd go back and assess your risk. It's a similar situation. And so, there's been cases, we've heard of them, where if it was a nation state actor, the carrier saying, well, that's an act of war. That's not. So that's where then you get in all these legalities of what the policy covers and what it does. And that's why there has to be a little more predictability so that people can make investments with an understanding of the outcome.
No, exactly. And it's, and that investment is on both sides because it's, everyone wants to know kind of what steps should be taken, what steps arguably are optional. And then, even then, what should you not be doing? Because there's obviously some of those on the security side. And for those of you just joining, I'm talking with George Pappas from Intraprise Health. We've been talking a lot about kind of the framework and state of security. And George, as we're thinking about, controlling some of those risks, it seems like one area that is gaining more prominence and especially in healthcare seems to be the focal point for more attacks are the vendors. I think a lot of those breach notifications are because of issues at business associates. And intuitively, that seems to make sense because they're working with multiple organizations. So they've got more magnitude of data on hand. So, given your immediate reaction, it sounds like you agree with that position. But, kind of why do you, maybe from a more technical standpoint or more experience, like what are you seeing is actually occurring out there? And, why are these attacks becoming more frequent?
Yeah, no, this is a big topic, and we have an automation platform and work we do with our clients, so we're knee deep in it. The fundamental situation, Matt, is that almost every hospital, except the really large ones that have a lot of technical staff, they buy almost every piece of software that they use. So you could be a 200-bed small community hospital and have like 300 application vendors. They all add up. Your cardio, group that's doing some kind of predictive modeling has one package. You got your EHR, of course. You got revenue cycle, scheduling. Next thing you know, you turn around, you have hundreds of these applications. And the challenge is, as I mentioned earlier, they're all software applications. Who built them? How have they been built? Who is assuring that they are secure? How is that being monitored in your licensing agreement with them? How is that being instantiated in your BAA, your business associate agreement? And so for a client, the problem they have is that their cyber security team is usually very small unless you're a very large system, like 2 or 3 people for a 900-bed hospital with 100 clinics, right? So what are they doing? Well, the part of the issue too is there's split ownership. You've got legal who owns the licensing agreement, but then you have the CISO who owns the security assessment. And so what you need to do is find a way to have every vendor go on the record in some form attesting their security posture, as well as some form of ability to understand when they have an incident. And we have automation systems for that, but you got to bring that data together with what is kind of the legal liability posture you have relative to all these people. Because let's just say you had 100 vendors. What's the direct damages in your BAA? How does that relate? How does that reflect to the potential risk of that third party? So part of what we do in any good risk management will go through a NIST type of categorization. Well, is it someone who's in your EHR? Okay. Is it someone who's seeing all of your clinical data for e-prescribing benefit analysis? Okay, that's much higher impact. Someone that is coming in and touching one piece of your scheduling, risk, but not as much. So you've got to sort of categorize the impact, the potential severity, and then ask yourself with those top tier NIST risk assessed people, what would happen if they had an event? And then really work on and evaluate the license agreement, the BAA. Maybe you do a more aggressive recurring security assessment of them, which a platform like ours lets you do more dynamically than others. So it's about getting a portfolio view with a reasonable amount of effort that isn't this combinatorial exercise of manually talking to 300 people and tracking all that.
So kind of thinking through those security assessments and having gone through answering them in various roles that I've been in, it's, what information should be sought in them? And then, how often do the parties receiving it, in some of these hospitals where the resources might be constrained, how much do they actually understand of the information that they're receiving in response to the questions that they're asking?
Very good question. So first thing, you want to, as far as what you're asking for, you want to understand the level of penetration and other types of simulated cyber attacks they've undergone and see some of those results. So NIST has a framework for this. High Trust has a very intensive framework for this. You want to understand how they're managing their team's access to the development environment and the QA environment and the operational environment that you're running on, your platform that you're renting as a SaaS application is running on. You want to understand where they are in certain patch levels of operating systems, network management systems, and all that. So that's kind of your, I don't want to say garden variety, but that's kind of the technical plant and equipment and basic operational fitness of your third party, okay? You also want to understand what modules they're using inside their system. In the old days, with open software, we always had sort of an open software list because you had to treat that very differently than things that were proprietary. I actually think as the federal government is getting more assertive on what they call SBOM, software bill of materials, you're going to see sort of a cybersecurity disclosure requirement at some point. I think it's healthy because right now you have scanning technologies you can use to sort of get at that. You have other things you can use, but really you want your vendor to go on the record. It's their responsibility to do that, so you know what those are, and then make sure that there's coverage for those. So that's kind of your questions. Now, as far as understanding the answers, that's a really good one. That's where our service team can help support if a hospital doesn't have the staff, because the irony is a lot of hospital systems can't find the staff, even if they could hire them. Or if they can hire them, they can only hire a small number of them, and they have to really get as much leverage out of their time as possible. So another thing that we've been doing is we've been applying some AI techniques to evaluate that evidence and give the human analyst a clue. Hey, these things look okay, check over here. So we're sort of demystifying some of that nomenclature. So maybe a medium skilled analyst would be getting help from our AI agent to say, oh, okay, yeah, I'll need to, and I can go talk to someone about this. So we're trying to separate the needles in the haystack that need more attention so that, these people are not having to go read, 100 pages of question and answer material to know what they really need to focus on.
And I guess also another component of helping with that is, when you're framing those questions, how are you actually, or what type of response are you trying to elicit? Because I've certainly gone through ones where the only option is yes or no,
right?
And the answer is usually somewhere in between that, and you try to figure out which answer is going to get me in the least amount of trouble if it proves to be wrong.
Yes. Well, there's an art to the questions, as you point out. The other dynamic that's very important, and our platform does this for a reason. You don't want to have it be a bunch of back and forth email question separate objects. You want a rolling journal of a conversation between your risk team and the third party. And that's what an environment like ours provides, because you want to have an audit trail. Oh, you said you have X. Well, do you mean Y? No, I mean X plus. Well, how do you do that? Well, we do this every week. Okay, can you send me the scan? And so that entire conversation is auditable, and it's a trail. It helps the vendor, also the partner, understand what they've said, but it helps your team as you're bringing new people onto a project or someone leaves, unfortunately, that you have really a record of the conversation that went before. And so what you're really doing is saying to the partner, look, we understand this is a challenging area, but we want a full answer. But we also want to make sure both of us understand how we got to the answer that we end up with. And that way, it's a more productive discussion and ongoing risk assessment.
And that definitely makes sense, because it's, as you said, if both parties can be able to see, how the responses have evolved and, what is actually, of importance to both sides, that just benefits everybody.
Yes.
So, and then kind of thinking about that, it sounds like you put a lot of thought and consideration into the framing of those questions and what to ask. On the flip side, what are questions that are just either meaningless or unnecessary in this process? Because I suspect you've probably vetted questionnaires from folks and might see some fluff that could be present.
Yeah, I mean, there's a lot of kind of just very obvious, simple things. Like someone might say, how old is your application? Is that an indication of architectural fitness and decay? Not really. I think more how many releases have you done is more important. You talk about the installed user base, talk about release history and management. That's just one example. There's so many. I also think about, well, they might say, or you might ask, well, have you done your X? Those are good things to know, as long as the X that you're asking has some understandably verifiable quality. And, when I say that, again, this is where our high trust lineage kind of is our guiding light, because high trust assessment in and of itself has internal validation by the assessor and by high trust, with explicit evaluation of policies being followed and everything else. But if I just said, have you done your NIST assessment? That doesn't tell me anything. Or GR, you were 3.75. It doesn't matter. I want to see, what are the findings? What are the outstanding high risks? What's the remediation history? That tells me, do you have a culture of constantly trying to improve? So just saying, did you do this, is far less interesting than, how many remediations, how many outstanding, what's been your progress. That is the real issue you're trying to get. What is the culture of compliance of that partner?
Yeah, and it kind of just makes me go in the direction of ask a question, then always follow up with why,
right?
Or what did you do with that information? Because as you said, it's many people can answer that surface level,
right?
But I think to your point, if there's a true culture of security and attention to detail, then there's going to be a lot more process around implementing and working with the information that you gleaned out of whatever test or outside report that you got.
Exactly. And in the end, you're trying to establish a trusting assessment between the two parties. And it's sensitive. Of course it's sensitive, right? The vendor who you have the BAA with, their legal team has their concerns, right? There are representations in there that should something happen, there could be an issue. So there's a lot of inherent, I'll call it nuance on both sides, that where the ability to have that as a conversation that is audited allows for a more respectful but transparent exchange.
Yeah, and I think that, as you say, framed it as a conversation is also important, because I've certainly been in many instances where it didn't feel like there was a conversation. It was just almost a check the box approach on one side of saying, okay, you do this, okay, you have to have all these things, without actually kind of thinking through the details of, wait, maybe you're not actually getting access to all this level of information, or you're not connected to our system even. So
Right.
it goes back to your earlier point of you actually need to grade out the actual risks and use that to create an accurate score of what is going to happen with a particular interaction.
Right. And I also think, Matt, this is where it's incumbent on the client to not to overdo it. You don't need to grind everything to the dust. Be respectful on both sides. It's, I have the gold, I make the rules kind of attitude is not going to get you the kind of enduring relationship with a partner where you can have those kinds of discussions and actually be clear about, what is really important and what isn't.
Yeah, no, and another great point. And George, believe it or not, we're already almost out of time.
Are we?
So I'm going to close with one final question, which is, what do you predict is going to be the next big cybersecurity issue for healthcare?
Well, I think that unfortunately, all these cyber criminals are getting better at using some generative AI to make more intelligent phishing, more intelligent penetration methods. And so that's going to be the next wave of things that we have to deal with.
No, I think that's a great point. It's certainly come up on a couple of recent conversations that I've had. So it's, now that I've heard it multiple times, it's, should be a clear warning to most people of you have to be on the lookout. But as I said, believe it or not, we are already out of time. Wow. I want to thank my guest, George Pappas, for a great conversation today.
Thank you.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.